Hi, welcome back to Therapeutic Kinesiology. I'm Marianne Foster, and I help people with body problems using kinesiology-based solutions. Today, we're going to look at the shoulder pinch problem and what occurs in the joint and how you can work to resolve it. So to begin with, we'll talk about the acromion process, which is this bony ledge on the top of the shoulder. The head of the humerus is under it, and the acromion is the very top part of the scapula, which is the socket. The head of the humerus is the ball in the ball and socket of the shoulder joint. So what tends to happen is there are two tendons coming underneath the acromion process, the biceps tendon and the supraspinatus, which is the rotator cuff muscle on top of the shoulder. Let's feel the acromion and move your arm. And as you do that, you can feel the acromion will stay stable. If I lower the hand onto the ball or the head of the humerus, you'll feel it moving back and forward in the socket. As my arm goes back, the head of the humerus goes forward. As my arm goes forward, the head of the humerus goes back. As the arm goes up, it should go down. And if it doesn't, this is where we get problems. There are three types of joint mechanics in a ball and socket joint: spinning, rolling, and gliding. In spinning, the ball in the socket spins around like this, just like a top spinning on the ground or a merry-go-round. In the shoulders, what that looks like is medial and lateral rotation. You put your arms out to the side and roll your hands, you can feel the spinning. If the scapula is stable, the movement will just happen in the humerus. If there's any kind of restriction or tightness around the socket, the movement of the humerus is going to pull the socket with it. So you can see how I'm moving my whole shoulder girdle there, whereas here I'm just moving the bone in my upper arm. So getting a real clear spinning in the socket is important. As you do this exercise with me, just feel the head of the humerus turning in the socket and use that movement to spread the synovial fluid around the inside of the joint and to lubricate the socket. The second two joint mechanics that are important to understand are rolling and gliding. In the rolling action, the ball is rolling across the socket. Now, obviously, as this ball rolls across the surface it's on, it's continually changing contact with the surface and eventually will roll off if it doesn't glide at the same time. So here's the combination of rolling and gliding, which is what occurs in the shoulder socket. It's the failure to glide that creates chronic pain and impingement syndrome. To feel the gliding in the socket, put your hands in this position. I call this exercise chicken wings, and what we're doing is we're giving ourselves proprioceptive feedback so we can feel the stability at the head of the humerus. And as the elbows come up, and we'll bring them toward the front, feel the head of the humerus glide down. As the elbows go down, it comes back up, and vice versa. So just moving it around, just moving your arm around and feel how that head of the humerus glides in the socket. So as the arm goes up, head of the humerus comes down. As the arm goes down, head of the humerus goes back up a little bit. As the arm goes behind, head of the humerus goes forward in the socket. And as I take my arm forward, the head of the humerus goes back in the socket. Notice how I'm keeping my scapula stable here to feel my head of the humerus glide. If the head of the humerus fails to glide, a PT or manual therapist will actually force this down as you raise the arm up, which I'm doing on myself here by pulling down on my upper arm as I raise my arm. Another way to pattern this is by lying on the floor and using the floor to give you feedback on the back of the shoulders. To work the shoulder joint mechanics while you're lying on the floor, lie on your back. Feel that space between your shoulders open. You can even hug yourself. Just kind of jimmy around to open that space. And then putting the arm out at the side. We'll do one arm at a time, rolling the arm like a rolling pin. I'm actually reaching with my fingertips to stretch my joint space open and just feeling that spinning inside the socket. We can do it lower too, in different locations to feel the spinning. Now, again, hand on the ball joint of the socket. As the arm comes up, feel it sinking back into the ground. As the arm goes overhead, feel it gliding down toward the feet. And try to keep all of this area grounded on the floor so you're not lifting it up. And then slowly raising the arm overhead again, feeling it going back. And as I lower the arm, the head of the humerus goes up. Make sure to do both sides. Just moving slowly, getting a sense of that head of the humerus seating in the socket as it's moving. So it's always repositioning slightly to stay centered in the socket. Avoiding those pinchy feelings from having it go too far up in the socket, too far forward, too far back. Okay. You can put both hands above you and just doing a slow circles, drawing circles in the air, feeling the head of the humerus sinking back into the floor as you do this. Now I'm going to open the arms out slowly. Again, keeping that feeling of the head of the humerus sinking back and shifting position in the socket. Moving your arms a few times. Move slowly in a position that's comfortable. And when I do feel shoulder stiffness coming on after doing some heavy lifting or gardening or a lot of manual labor, and I'll start to feel this get stiff, I'll do these exercises and I usually can take away any pain or discomfort or stiffness. Well, I hope you liked this video. I hope it helped you. If you did, please give me a thumbs up, tell your friends, and join my YouTube channel. I'll see you again for our next session in my next video. Take care. Bye-bye.